We have a patient with A-fib, the CHADS-VASc 3 on apixaban, who presents with a traumatic pneumothorax and gets a chest tube placed. The apixaban is then held. It is now day 4, and the chest tube is still in place. You ask the Palm Fellow if it is safe to restart the apixaban, and they are ambivalent. The patient asks about their anticoagulation, and they ask you what their risk of stroke is over the next day or so. As a reminder, here's the CHADS-VASc score and the associated risk based on the score. So with the score of 3, the risk of stroke is 3.2%. So what do you tell the patient? That it's 0.0087%, which is 3.2% divided by 365. 3.2%, something between A and B. This is a trick, but I don't know what the trick is yet, or I have no idea. So I'll give you 20 seconds to put your nickel down, and we'll go from there. All right, and with that, it's C. Now, after we talk about this, you may be upset and say this was a silly exercise. I think this is a really interesting one, and I think it's worth discussing. That's why we're doing it. So what the heck is a CHADS-VASc? Let's start there. So it estimates annual risk of stroke and also estimates the risk of stroke, TIA, and systemic embolism. And so here on MD Calc is all of your different parameters that go into a CHADS-VASc score, okay? So now that we're all on the same page about that, we got to do a little bit of math. So if you look at the breakdown here, there is the CHADS-VASc score, the risk of ischemic stroke, and then a composite of these 3 things. So very often we only look at the risk of ischemic stroke and not the other. I do think it's interesting if you look at score 7 and 8, the risk of ischemic stroke with an 8 is lower than that of 7. And there's this weird paradoxical decrease. This actually just reflects the findings published in the study used to validate the score. So don't put too much stock in it. And you may say, well, it's like a 0.4% difference, so who cares? Well, this is a talk about math, so that's why I'm mentioning it. So we got to do some probability. This is inspired by Dr. Jesse Currier, our interventional cardiologist. So the stroke risk calculation has to be calculated based on the probability of being stroke-free each day. So you have to assume each day is an independent event. All right, you ready for math? Let's assume you roll a dice once per day and you want to calculate the rate of rolling a 4. The chance of you not getting a 4 each day is 1 minus 1/6. Hopefully that makes sense to everyone. The chance of you not getting a 4 each day for 7 days in a row is 1 minus 1 to the 6th to the 7th power. So the chance of you getting a 4 over the course of 7 rolls is 1 minus that. Hopefully I did not lose everyone. So that means your weekly rate of getting a 4 is 1 minus 1 over 6 to the 7th. Your monthly rate is actually 1 minus 1 to the 6th to the 30th. And your annual rate is 1 minus 1 to the 6th to the 365th power. So a lot of math. Please go back and review this if you're confused. So let's break it down a little differently. Your annual risk is 1 minus your daily risk to the 365th power. So your daily risk is actually this. So this is where the hardest math is. You're taking the 365th root of something, okay? So your daily risk of stroke is actually this. That is per day, all right? And that's what the question in the beginning was asking. So we were holding this patient's apixaban for 4 days. The patient asked you, what is my risk of holding it today or one more day? So here's what the calculations look like if you actually do the math. So this is from CHADS-VASc, from MD Calc. And if you do the math, you get this like crazy thing for daily risk. And if you actually compare that to just dividing by 365, look at how stinking close it is. So some of you may have been taught just divide by 365 and that's fine. Although that is mathematically incorrect, you end up at the right answer here effectively. So you may say, thank you for this useless exercise. What do I do with this? Well, it turns out the daily calculator risk looks really low, but the basic mathematical modeling doesn't play out in practice because this is per day. Now, there is something inherent to the risk that happens by holding it each day. Your risk should theoretically go up. That is not captured in any way. So ultimately, we don't have a clear answer here. So all of that is to say, if you want to divide by 365, I think that is fine for your risk over one day. That does not predict the risk over a week, a month, etc. We need some better mathematical model. I do want to bring that up because if you look at these numbers, they're so tiny, but ultimately the annual risk is not that low. And so don't just blow it off saying the daily risk is super low. I'm sure all of you have seen instances where patients end up clotting when we are holding anticoagulation, which is why we were having this discussion. So in summary, here is what the estimated annual ischemic stroke risk is based off of Chad's VAS scoring. Here is the calculated daily risk, 1 minus the 365th root of 1 minus your estimated annual risk. And if you were to use that model, these are the numbers you get. There's no good mathematical equation. And remember that this assesses annual risk and does not reflect true daily risk.